Acquired immunodeficiency syndrome or AIDS is a chronic, life-threatening condition caused by human immunodeficiency virus. It damages your immune system and makes you fall sick easily. Why is HIV fatal? Over time, HIV destroys so many of those cells which are necessary to fight off body's infections and diseases. When you have HIV infection, the number of CD4 cells in your body are too low and the number of immune cells are also too less. AIDS is the most severe form of HIV infection and it can lead to death over time. What are the modes of transmission of HIV infection? One can get or transmit HIV infection through specific activities. Most commonly, people get or transmit HIV infection by specific sexual behaviors and needle or syringe usage. Only certain body fluids such as seminal fluid, pre-seminal fluid, rectal fluid, vaginal secretions, breast milk and blood from an HIV infected individual can transmit HIV infection. HIV can spread from mother to the child during pregnancy, childbirth and breastfeeding, although the risk is higher if the mother is living with HIV infection and not on any medication. For a healthcare worker on job, the transmission of HIV infection occurs through needle stick injuries from HIV contaminated individual or sharp objects. A few misconceptions are prevalent about HIV transmission, such as transmission of HIV infection through kissing or sharing toilets, which is completely false. Such social stigma should be avoided. The only way to know for sure if you have HIV infection is to get tested. Knowing your status is very important to prevent transmitting and getting HIV infection. It is recommended everyone between the ages of 13 and 64 and pregnant women get tested for HIV infection as a part of routine health checkup. People at high risk such as sexual workers, people with multiple sexual partners, homosexuals and injectable drug abusers should get tested for HIV more often. The three tests which are used to detect HIV infection are NAT, ELISA and Western blot technique. How to avoid transmission of AIDS? There is no vaccine to prevent HIV infection and there is no cure for AIDS. You can protect yourself and others from getting HIV infection. Use a clean needle. If you are using a needle to inject a drug, make sure it is sterile and do not share it. Use a new condom every time you have anal or vaginal sex. Women can use female condoms. If you are pregnant, get medical care right away. If you are HIV positive during pregnancy, there are all chances that you can transmit that to your child. If you get treated for HIV during pregnancy, you can cut off the risk of transmission to the child significantly. If you have any concerns, do visit your nearest Humain Health Center and assess your condition. If you have any questions or queries, type it in the comments below or write to us at care@humainhealth.com. Subscribe to Humain Health's YouTube channel for more health related videos.